Let's continue talking about legal drugs and then get into illegal drugs. Our next legal drug is nicotine. Nicotine is, as I'm sure you know, addictive with no medical use. It's been used by roughly 8% of high schoolers, although that number is increasing when vape pens are becoming more popular. Nicotine acts as a stimulant to the human body, increasing heart rate, brain activity, and respiratory rate. It's found naturally in tobacco, as I'm sure you know, but also in related plants such as tomato, potato, and coca used for cocaine. It acts naturally to protect plants against insects eating the plants, much like caffeine does. It takes a matter of seconds to be absorbed because the way that people consume nicotine is through the respiratory system, and this is absorbed into the human body much faster than the digestive system. It also takes roughly 2 hours to be eliminated. Nicotine also crosses the blood-brain barrier. As you can see from this picture here, again, the molecule is fairly small, and so it's able to cross that barrier with ease. There, in the brain, nicotine activates brain receptors, specifically brain receptors called nicotinic acetylcholine receptors. These are receptors for a molecule that's similar to acetylcholine called nicotinic acetylcholine receptors. It increases the number of these receptors in the brain with every inhalation, causing the number of the receptors in the brain to increase for the nicotine. This is what eventually leads to the addiction for nicotine and the withdrawal symptoms. What these receptors eventually do is they trigger adrenaline, and adrenaline is the molecule that's responsible for increasing heart rate, blood pressure, and respiratory rates. It also results in higher glucose levels in the blood to account for these increases in bodily activities. Eventually, over time, if these receptors are not reactivated, as I mentioned, it can cause withdrawal symptoms. And so smoking tobacco over time leads to an addictive state where when you smoke, you actually feel relaxed and calm and a little more alert. Newer users don't experience these feelings as much. In cigarettes, the long-term effects of nicotine use can be fatal, particularly from lung cancer, the leading most preventable cancer in the United States today, and also the most deadly. But in addition to killing people from lung cancer, cigarettes also kill people through COPD. COPD actually kills more people than lung cancer does. COPD stands for chronic obstructive pulmonary disease, and this is what Leonard Nimoy, the first Spock on Star Trek, died from. He smoked for 20 years, and even though he quit after 20 years and didn't smoke for roughly 20 to 30 years at the end of his life, he eventually died from COPD as a result of smoking cigarettes. COPD is a combination of bronchitis and emphysema. Bronchitis is inflammation of the airways, causing individuals to not be able to take in as much air into their lungs. Emphysema is the destruction of the lung tissue itself. What this does is it results in the lung tissue becoming so damaged that it can no longer absorb oxygen efficiently. Other versions of consuming tobacco, such as through a water pipe or hookah or a vape pen, does reduce the risk of lung cancer, COPD, and other ailments caused by smoking cigarettes. However, they are not as healthy as not smoking at all, and can still mildly increase your risk of these various diseases. This is true of smoking other things, including marijuana. It's healthier to smoke other substances through a water pipe or vape pen, but generally speaking, It's the healthiest state to not smoke it at all. Cannabis or marijuana is illegal in many parts of the country still, especially for recreational use. And so we're going to transition into our illegal drugs by first talking about that. Before we get there, though, I wanted to show you this really informative graph. This graph shows you a ratio of dependence potential, so this is addiction, with low addiction on the y-axis here and high potential for addiction up here. And this is plotted with the lethal dose, so how much it takes to actually kill you. This is not necessarily an indication of overall damage or side effects, but is an indication of how lethal it can be. This is plotted in an inverse relationship where the more lethal it is, it's located on this end of the graph, and the less lethal it is, it's located over here. As you can see, heroin is the most addictive and most lethal of the drugs that we'll be talking about. Alcohol, interestingly, is almost as lethal as heroin, but less addictive. Alcohol is still more addictive than caffeine, and you can see nicotine is more addictive but less lethal than alcohol. This is a purified version of nicotine, and most people don't consume purified versions of nicotine or caffeine because they can be lethal in certain concentrations. Over on this end of the scale, we have marijuana, which, as you can see, and we'll talk about this in a moment, is addictive. It's about as addictive as caffeine is. So as addictive as you are to your cup of coffee every day, if you smoke marijuana every day, that's how addictive it would be. Fortunately, marijuana is not nearly as lethal as some other drugs that we're going to talk about. The least lethal and least addictive is acid, LSD, and psilocybin. Psilocybin is the drug found in hallucinogenic mushrooms. We'll be talking about these as well. So let's talk about cannabis next. Cannabis, or marijuana, has been used by roughly 36%, so 1/3 of high school students. It is addictive, but it does have some medical use in reducing the pressure in glaucoma, as an anti-nausea medicine for people on chemotherapy, and it may even, for unknown reasons, treat multiple sclerosis. Cannabis contains the drug tetrahydrocannabinol, or THC. It also contains the drug CBD, which is an acronym for a single word, cannabidiol. Both of these drugs are used when consuming cannabis. However, it's the THC that have the psychoactive properties. CBD may be involved in also helping patients with multiple sclerosis and seizures, anxiety, and pain. And so when consuming cannabis, you're consuming both of these drugs. Because cannabis is often consumed by inhalation, it takes seconds to be absorbed. Importantly, if consumed by digestive tract, eating something that contains these ingredients, it would take 20 to 30 minutes to be absorbed by the body. Once absorbed, it takes roughly 1 to 2 days to be completely eliminated by the body. However, metabolic products of THC and CBD can still be detected for weeks after. THC results in a few known side effects. It does have effects on short-term memory by blocking receptors in the hippocampus. The hippocampus is the region of the brain that's involved in forming memories. THC, though not a stimulant or depressant, does inhibit neural function. It also blocks receptors in the cerebellum and basal ganglia regions of the brain, causing effects on learning and problem solving. So this is really not the drug to take while in school. It increases the heart rate, though, so while it has a depressive effect on the brain, it stimulates the heart and cardiovascular system, which is why it cannot be classified as a stimulant or depressant on the whole. This depressant activity in the brain and stimulant activity of the heart can lead to anxiety, paranoia, and panic attacks in some individuals. It also stimulates the digestive system while decreasing nausea. Long-term use of cannabis has shown to increase the risk of hallucinations and delusions, leading to, in some individuals, psychosis. Also, as mentioned previously with nicotine, if cannabis is consumed by inhalation through using traditional methods, it can increase the risk of lung cancer and COPD. Next, we'll talk about psilocybin. Psilocybin, if you remember, is the molecule involved in psychoactive mushrooms. It is not addictive, and there is no medical use. These drugs that we're going to be talking about now are used by 5% of high schoolers and less, so fairly rare. However, there is a long history of using psychoactive mushrooms by shamans, medical men in the Americas and elsewhere for centuries, and is currently being investigated for treatments in psychotherapy. Psilocybin is a depressant in that it decreases neural activity. How this leads to hallucinations is something that we're going to talk about briefly in a moment. There's just not one species of mushroom that contains psilocybin. It's in fact found in over 200 species of different mushrooms. They're taken by eating the dried mushrooms, and because they're taken by eating, they generally take effect in 20 to 30 minutes. Their effect lasts up to 6 hours. This molecule, psilocybin, looks similar to other molecules in the brain, specifically serotonin, and results in some effects of serotonin in the brain. This results in euphoria, visual hallucinations, a distorted sense of time, and panic attacks, as well as muscle weakness and nausea. This causes regions of the brain to decrease in function, especially areas involved in self-awareness. This may allow for more input from the environment to the brain because the filter for eliminating unnecessary inputs has been diminished. Long-term effects of psilocybin include flashbacks, impaired memory, and psychiatric illness. This is similar to other related drugs like LSD and acid. In our next section, we'll continue to talk about psychoactive drugs that are illegal.